I'm shivering, I have a fever. Oof, I can't stop shivering, I'm sick.
What is the main difference between a cold and the flu? Well, I need to start by saying they have many shared symptoms, so it's not easy to tell them apart. Some possible ways to tell them apart can include causes. The flu is caused by the influenza virus, whereas colds are generally caused by rhinoviruses. So they're caused by different types of viruses. Symptom onset. Colds generally develop over a few days, whereas the flu is generally much more sudden and it feels a lot more severe. Number 3, symptoms. Both the cold and the flu have common symptoms, which can include cough, congestion, and fatigue. But the flu generally has additional features like fevers, headaches, shivering and shaking, body aches, severity and duration. Flu symptoms are generally much more severe than cold symptoms. Cold can creep up on you with a congested nose or a sore throat. You might hear my congestion now because I currently have a cold. Flu, on the other hand, feels a lot more severe. When I had the flu, I felt like I'd been hit by a truck. I was bedbound for days and I was only able to go to the bathroom or go to the kitchen. I wasn't able to do my normal routine and I was largely bedbound. So the flu is generally more intense and sticks around a lot longer.
I can't stop shaking.
How severe your symptoms are with the cold and the flu will depend on lots of factors, like your age, your health history, any medications you currently take. If you're fit and well and you have the flu, it could affect you less than someone who's got lots of health conditions and a really severe cold. So if you're in a vulnerable group like the elderly or you're someone on cancer treatment, it could affect you more than someone who's fit and well. How to avoid catching a cold or a flu. Number 1, hygiene. Make sure you regularly wash your hands and make sure you avoid close contact with people who are unwell, symptoms like coughing and sneezing. Vaccination. Annual flu vaccines are the best way to prevent severe complications of influenza. Healthy lifestyle. Maintaining a healthy diet, making sure you get enough sleep and rest with the right level of vitamin D and exercise will all help keep your immune system as good as it can be for a speedy recovery. Number 1, rest. Adequate rest is crucial to allow your body to recover. Number 2, hydration. Even if you don't feel like it, your body really needs the water and the fluids. If you have a low appetite, you could consider lighter foods like soups. Make sure you keep your nutrition as good as you can, even when you're feeling poorly. You can usually buy medications from the pharmacy to help you with your symptoms. If you're having a lot of nasal congestion or fevers with influenza, you could consider medications like paracetamol. Isolation. If you live in a household with other people, it's also important to remember the impact on them. Are they vulnerable? Do they take any medication which affects their immune system? And if it is the case, you might decide to spend some time away from them or keep your door closed and make sure you avoid spending too much close contact with them. There are some suggestions that vitamin C and zinc and probiotics can all help. We'll usually need to take the right doses over an extended period of time to get the full benefit of these medications. So generally, a few tablets when you're feeling sick aren't going to make a huge amount of difference, but if you decide to try it, that's up to you. Some of my friends and patients, they find that vitamin C really helps them, and I tell them if they want to take it, that's up to them. If you have the cold or a flu, there's some important symptoms to watch out for when to seek medical advice. The baby or a child that's unwell, especially if it's affecting its feeding or they've got less wet nappies. If you're over 65 and you're starting to feel very unwell, if you're pregnant, got a long-term medical condition which affects your immunity, conditions like diabetes, or conditions that affect your heart, your lungs, your nerves. If you have a weakened immune system with conditions like chemotherapy or HIV, or it's been 7 days and your symptoms are getting worse and not better. Do you need any further tests? Well, if you're feeling unwell, it's best to speak to a doctor like myself. We'll go through your symptoms, examine you, check your health history, and make sure there's nothing else going on. In some cases with the flu, we might decide to test. There's a number of different tests that can detect flu viruses. One of the most common is the rapid influenza diagnostic test, and it aims to work by detecting part of the virus, called antigens, which are triggering an immune response in you. Do you need antibiotics? Well, it's a question that my patients will often ask me, and I will highlight these infections are caused by viruses, not by bacteria. Antibiotics do not work for viral infections. We don't generally recommend antibiotics because they won't relieve your symptoms and they won't help you recover faster. In some cases, we give antibiotics if you develop a bacterial infection or you have risk factors that could lead to fluid or infections building up in your lungs. So it is possible to develop bacterial infections as a result of viral infections, which is when we give antibiotics. How long do infections last? The duration of a cold or a flu virus can vary, but with the flu it likely a few weeks to fully recover, and with a cold it's generally up to 2 weeks. Can you have the flu or a cold and no symptoms?
Lucia?
I think I'm too close to you right but I really believe I'm immune, because every time someone's getting sick, I'm like as close as possible to them, and then I don't get sick.
We're about to see.
Well, with the flu, it's generally quite severe, so you'll probably know about it. However, it is possible to have a viral infection, especially something like a cold, and be asymptomatic, especially in its incubation period. Incubation period is a time between getting exposed to the virus and developing symptoms. It can vary from virus to virus, but it's typically a few days. So it is possible to have a viral infection and have no symptoms, especially if it's a virus causing things like a cold. Thanks for watching Your Traveling Dog.